A lack of medical supplies has forced Johannesburg's Charlotte Maxeke hospital to cancel all non-emergency surgeries. At least 20 patients have been affected so far. The Gauteng Health Department says it's monitoring the situation. Provincial chairperson for the Democratic Nursing Organization of South Africa, Sempiwe Gada, joins me to discuss this. Very good morning to you, Sempiwe Gada. Talk us through the situation. What's going on here?
Well, we have done our own, engagements with the department to find out what is happening, because this is not a normal situation, and we, as a nursing organization, get concerned when such things happen, and also, they are not happening at the correct time. So we have engaged, and we have been reassured that the matter has been sorted out. It was just internal challenges in the hospital in terms of the procurement issues.
Okay, like what? I mean, how's it going to be sorted out? What are the internal challenges, and what's missing? I believe that there are things missing like surgical gloves.
Well, what comforts us is that these challenges are not because of financial shortages and so forth. The finances are there. It was a matter of incompetency in terms of the procurement department, and this also confirms our long-held view as a nursing organization that you cannot take people who do not have the necessary expertise in the health industry handling procurement for a hospital. I often make the example whereby you'll find that in a ward you've got 100 ml syringes in abundance, whereas we normally use your 10 ml and 5 ml on a daily basis. So this just shows that we need to beef up procurement and ensure that we put people that understand, the daily runnings of a hospital in a ward, in a theater, and everywhere, so that they can be able to procure things that we need and that we use on a daily basis.
I mean, it's pretty mind-boggling, isn't it? It makes me extremely angry that those sort of people continue to remain in those positions, because now what we're seeing are 20 people who've had their surgeries delayed. I mean, what's going to happen to them? What sort of support can they expect in this time?
Well, in my engagements with the HOD this morning, he has assured me that he will be, going into the hospital and ensuring that the people who are responsible for this, there is consequence management, and which is an action that we support, because that's what we're calling for. Because had this happened in a clinical setting, you'll be seeing consequence management, at the speed of a lightning. So even in this case, we understand that it's non-emergency operations that have been delayed. But be that as it may, it has disorganized those patients who are looking forward to having those surgeries. I mean, there's no surgery that is not necessary. So we will be also, after this interview, getting in touch again to ensure that we visit the hospital and we ensure that those who are responsible for this, shortage of these equipments are taken to task, and these patients should also get redress.
We know that the MEC... Let me ask you this quickly, if you don't mind me jumping in. I mean, we can't even deal with current situations like this. We can't get access to gloves, we can't get the right people working in the right jobs, and yet they want to impose this NHI system. I mean, shouldn't we be fixing what's going wrong right now in our hospitals?
Well, I think, Jane, we must also not isolate this problem and then use it as a measure to say that we cannot deliver NHI. I agree that the incompetence is absolutely not acceptable, but we must put it on record that we think that the universal health coverage, which is the NHI, is what South Africa needs, so that we're able to bridge the gap in the health sector that exists, and also be able to bring in and recruit the necessary skills to be able to make sure that we eliminate such challenges. And I must say that, Jane, if you look at the statement of the Democratic Alliance in this regard, for me, much as they are raising something that is genuine, but we must also be able to expose that what the Democratic Alliance is also doing is to ensure that it does everything in its power to discredit, the national health insurance, because the DA is on record not supporting the NHI. So we must not take these incidents and then make them as a deterrent to to say that we cannot afford to have NHI. I believe that these things can be sorted out.
So, Sure, I mean, let's leave it there. I mean, I think what I was trying to refer to is that everyone's petrified that we're setting up another SOE that's going to be plundered. But very good to hear your thoughts, and we're going to be keeping an eye on this situation to find out what's happened to them. Thank you very much for that.
Okay, thank
A reminder of the top story.